All right, schools across the country and here in southern Wisconsin are back in session, and COVID numbers are on the rise.
And now there's some confusion over booster shots. Here to separate fact from fiction, as he does each week, is UW Health's Chief Quality Officer, Dr. Jeff Pothof.
Doctor, welcome back.
Good to see both of you.
Does it surprise you that we're seeing a jump in cases in schools, and should parents be concerned?
You know, it's not so surprising that we're seeing a jump in cases in schools. You know, as we went into the school year, there's been a lot of variation and mitigation strategies that different school districts have taken. And we know some do a lot to protect those kids, and some really put those kids at high risk. So to see increased cases in that environment, it isn't so surprising. Certainly something that parents should pay attention to. You certainly want to keep your kids safe. It's better if they don't get COVID-19.
And where do we stand on a vaccine for kids up to 12?
Well, there's been some recent rumblings that Pfizer may submit their data in the coming weeks. You know, the process after that is the FDA would, grant potentially emergency use. After that, the AICP, that committee that looks at, how is it administered, things like that would meet. And then they would publish the dosing regimen, and then we'd be able to start vaccinating those kids 5 through 11 under emergency use, hopefully by the time Halloween rolls around. So, no promises, but the recent news is looking good.
Well, now there's debate about boosters. Do we need them? Do we not need them? What's your take on that?
Yeah, I think this is a difficult conversation. I think you're seeing a little bit of rift between different scientists. On one hand, we've got good data out of Israel that would suggest that if we were to give people who were vaccinated a while ago a booster dose, their immunity would increase and their likelihood of a breakthrough infection would probably be lower, even against Delta. On the flip side, we have a large world where a lot of people aren't vaccinated. And if we leave those folks unvaccinated, we increase the chance that a new variant develops there. So it's this battle between, small benefit for here in the United States, but certainly benefit versus bigger benefit, overseas. And how you balance that, I think, is a really difficult thing. As much as it is science, it's just the ethics of it.
And the Biden administration said boosters would start on September 20th, but they may have jumped the gun a bit. The FDA and the CDC have to approve that.
Yeah, I think, the White House was optimistic, but, with all things COVID related, we really want the science to drive the decision. So that's why I think it is good that these groups in the FDA, the CDC, they're meeting, they're combing through the evidence, really understanding what is the benefit of that booster and what's the timing. That's the right way to do this.
Are we gearing up for another difficult fall as we talk about the jump in cases in schools and still kind of this debate about boosters and vaccines? What are your thoughts on that?
Yeah, part of me is optimistic and part of me is a little bit worried. I think, if you look at cases, maybe they're leveling off a little bit. In other parts of the world, Delta has been kind of fast and furious. So the optimist in me wants to hope that over the next month or two, Delta starts to slow down and things start to look more like May. On the other hand, there's just a lot of things working against us, whether it's, schools and sessions of big festivals right now. It'll be the holidays before we know it. So we don't know how it's going to play out. But, I don't think we're automatically doomed towards, worsening cases. It might work out yet.
And get your flu shot.
Oh, yeah.
Yeah, I feel like we haven't talked about that for a while, but absolutely this year we are going to see more respiratory viruses. Get that flu shot. If you haven't gotten a COVID shot, get that at the same time. That's perfectly safe. But we need to protect ourselves against these respiratory viruses as we head into the fall and winter.
I mean, flu was virtually non-existent last season because of masks and social distancing.
Yeah, virtually non-existent. I think it surprised all of us last year that we just didn't see influenza. No one would have predicted that. But with masks and distancing, that's what happened.
Are you expecting flu cases to jump this year as we've kind of eased away from some of those safety protocols?
Yeah, I think with having it being more difficult with widespread masking, widespread distancing, people getting out and mingling, we really do think that we will see an influenza season this year. Hard to know if it'll be a mild season or a more severe season, but I think we will see more cases this year than we did last year.
Keep the mask handy.
Absolutely. We're not done with them yet.
All right, Doctor, great to see you again. We'll check in next week.